Hello, everyone. This is Katie Buss. This is First Aid CPR, FWS 243. And I am going to be going over the last unit, and that's going to start with chapters 20 and 21. And then I'll make a separate video on chapters 22 and 23. All right. So chapter 20 is all about water-related emergencies. And a lot of this stuff is just using common sense, being safe, being prepared, and being smart when you're out on the water. Okay. And, I'm sure there might be many of you who know people who have drowned. I know a few. And the reason I like to use Larry as an example is because I feel like many of us may have been in situations like this where we were out on a boat, hanging out with friends, having a good time, and never really thought anything bad could happen. This was one of my best friend's brothers. His name was Larry, and he drowned in 2007. Him and his friends were out boating for the day. They had been drinking beer all day. And at the end of the day, when they decided to bring the boat back in, Larry and another guy said, "Hey, let's dive off the boat and see who can get to shore faster." So they did that while the driver of the boat, drove the boat into dock it. And one of the guys who jumped in made it to shore. He turns around, Larry's nowhere to be found. And at first, they kind of thought he was joking around because he was a competitive swimmer back in high school. And they thought he was just messing around. And they ended up not being able to find him. Eventually, they did call the authorities. The area was searched heavily, and they didn't find his body until the next day. And honestly, they're not 100% sure what happened, but they have a feeling it had a combination to do with dehydration from being out in the sun all day and drinking beers all day, and possibly having muscle cramping, and then just not being able to keep himself above the water. And it's scary because he was a competitive swimmer at one point in time. So he knew how to swim. And he drowned after just a day of mixing boating and drinking. And it's not the only story I know of, but it's just to kind of really hone in the fact that these things do happen. And the only really way to prevent them is just to be smart about it. Okay, so let's talk about drowning. Obviously, it occurs when people experience respiratory impairment. They can't breathe, right, due to being submerged in the water. Some of them drowned and die, but others actually don't die. They are either saved or brought back, but can also leave them with permanent disability too. All right. So there are a lot of Americans that die every year from drowning and or drowning scares resulting in hospitalization. So it does happen a lot. I'm more from the Chain of Lakes area, where I grew up, and the Chain of Lakes, everybody boated because it was just access to it, and every single year there was incidences we heard of. So it does happen. Um, Drowning is the fifth most common cause of death from unintentional injuries in the U.S. It was pretty high on the list. Um, it's the second leading cause of death for those from 1 to 14 years old. That's very high for younger children. And obviously that makes sense because a lot of, kids 1 to 14 either can't swim or panic, things like that. And then children younger than 5 obviously have some of the highest rates of drowning because they cannot swim. And then there's a gap, and then it picks up at 15 to 24-year-olds also have a really high rate of drowning. And I found that really interesting. But what the studies are showing is that 15 to 24-year-olds, that's young adults, right? That's when they're first kind of either allowed to be away from their parents, with friends, and or the first time they're starting to experiment with drugs and alcohol, possibly. And so they actually have a higher rate of drowning than even like 12-year-olds, because generally 12-year-olds are with parents and they're not using drugs and alcohol. Whereas this a little bit older group is by themselves, and they're having more fun. They think they're invincible. So it's just something to keep in mind. Knowing those statistics may help reiterate the fact that it can happen quickly and it can happen to any age group at any time. All right, so there are some things that are going to contribute to how bad a drowning incident is. Okay, so or factors that contribute to drowning in general. So one of it is obviously unsupervised young children. And when we say that, people are like, okay, well, I would never leave my child unsupervised around water. But the fact is, a lot of these drownings are drownings that happen so quickly. And parents who said, I turned my head for a second. I didn't even think there was time, And I actually did have one of my uncle's, his brother, had a 2-year old drown in their pool a while back. And it was really, really devastating for the family. They were inside the house. They had a pool outside, an in-ground pool, and I think the child was inside with the mom. She was, cleaning up the kitchen, and he was right there, standing right next to her, playing with something. And he got quiet for a minute. She wasn't paying attention. She turned around. He's gone. She's looking all over the house because she didn't hear any doors open. And she finally just thought, oh my God, the pool. She went out there and they found him in the pool. So he didn't make it. And she said it happened so quickly, literally. Um, she's like, I can't even believe that there was enough time for this to happen. So just don't assume that these are people who are, not that they are neglectful parents. A lot of these people are actually very good parents, or caregivers, and it just happens quickly. Okay, so young children, we have to make sure that those pools are gated, they're secure, they do not have access to them, and things like that. The use of drugs and alcohol is another severe contributing factor to drowning. It's one of the top reasons that people do end up drowning. Okay. Also, accidents or traumatic injuries, such as someone diving into the water and hitting their head, those obviously are contributing factors to drowning. And then somebody who has a condition or some kind of disability that would cause them to lose control of their body in the water. So, possibly somebody with epilepsy who has a seizure while in the water won't be able to keep their head above water, things like that. And they often say sometimes people with a history of mental illness have higher instances of drowning. Okay. Now, when we say severity of drowning, that means like, can they be saved, right? So that's going to depend on how long they've been underwater. Okay. Obviously, the longer they're underwater, the less likely they are to survive. The temperature of the water, that's actually really important. Most people think that in warmer waters they would survive, but it's actually the opposite is true. The colder the water, the longer they can stay submerged and still be saved. So if someone were to drown in like a summer boating incident versus a winter ice water incident, the ice water victim will have a better chance of being brought back, unless, of course, they're obviously trapped underneath the ice or something. And then also the health of the victim. Obviously, if you have an unhealthy um, victims, old, young, they're not going to have as good a chance as a healthy adult. Okay. All right. So, how do you recognize when someone's having a water related emergency? And that sounds kind of silly or obvious, but a lot of people who are drowning actually don't or cannot call out for help because they're using all the energy they have to try to keep their head and their nose above water. And so sometimes they don't even make any noise. And so people just assume, well, if somebody was drowning, they'd be shouting. And that's not always the case. That's why they train lifeguards to be aware of, um, you know, spastic body movements and bobbing up and down, things like that. So they talk about 3 different types of water related emergency situations. First, you have your distressed swimmer. This person is able to stay afloat, their head is above water, but they're really starting to struggle to do so. They're starting to get tired, and they're starting to panic at this point. So, usually, if you can get this person out of the water before anything happens, that's great. The problem with those distressed swimmers, those are the ones that are likely to bring you under. They're panicking, and if you go out to them and it's over your head as well, they're very, very likely to easily pull you under because they're panicking. So you need to be careful about that distressed swimmer. Then you kind of have your active drowning victim. This is a person who's still conscious, but really is not being able to keep their head above water. So this is sometimes when it comes to that person who is bobbing and they get like a breath and then they go back under, right? And they're struggling with everything they have to get their head back up again. So again, this is a person who could drag you under very easily. They're panicking at this point. It's a pretty severe emergency. And then you have your passive drowning victim. This is where the person is either unconscious or possibly convulsing. They've probably inhaled water at this point. They may be floating face up or face down or sinking into the water. But most of the time at this point, they're unconscious. So they're passively drowning. Some things that you can do. First and foremost, they obviously want you to consider your own safety above all else. And I know not everybody agrees with that, because if you saw a child drowning, most of us would probably jump in without even thinking about it. However, from the American Red Cross's point, um, they see this all the time where people think, oh my gosh, someone's drowning, let me help. And they end up becoming another victim or getting pulled under as well. Okay. So it is important that they don't really want you going in the water unless you are trained and have the proper safety equipment to do so. So don't swim out to the person unless you are trained and you have rescue equipment. Definitely call 911 immediately without putting yourself at risk. Look and see if there's any lifeguards available or other people to help. Look and see if there's safety equipment or flotation devices that are available. And then also assess the victim. What would be the best way to get the victim at this point? Is there something I can throw to them that they could grab and hang on to? Or is she, like, for, I put this picture up here, is the person unconscious floating face down? She's not gonna be able to grab anything, right? So for her, I'd have to have something that has like a hook on it. And I know a lot of pool equipment they have stuff like that where I could kind of hook onto her and pull her towards me. But if I throw her something, obviously she's not going to be able to grab it. So you kind of have to see the condition of the victim and will they be able to use what you're trying to help them with. Also assess the condition of the water. Is this water above your head? They do talk a little bit about you could possibly walk up to your waist, but they don't really want you going more than your waist. And that's only if it's like, still water. Is the water fast flowing? Is the water have a rip current? There are lots of things that can contribute to your safety in the water, which is one of the reasons they don't want you going in. And just look for overall anything available to help. Yelling and screaming and telling someone to call 911 is helpful because usually people will jump in and start helping. So different types of assist. Obviously, they first want you to make every effort to get a hold of the victim without entering the water. So you can try to reach them. There's a lot of different things you can use to reach them as long as they're conscious. Branches, poles, oars, paddles, a belt, even a towel, things like that. A throwing assist. So maybe you can't reach them with something, but I could throw them a flotation device. I could throw them a line, a buoy, coolers. Do you guys know that most coolers actually float? Most boat cushions that you sit on, those are also flotation devices. Kickboard, life jacket, throw something to them that they could grab then and keep themselves afloat with until we can get them out of the water. And then the last possible thing would be a wading assist where you wade into the water. But again, the water has to be safe. It has to be shallow enough. You should be wearing a flotation device. And they don't want you going any deeper than your chest in order to reach that victim. So another example of the reaching assist, if you can reach someone, is be smart about it. Obviously, if you're helping pull someone out of the water, do it where they're not going to be able to also then accidentally pull you in because, again, they're panicking. Here are just some examples of things you could try to throw to them. A lot of these things you will find on boats. This new rescue stick thing is actually kind of cool because it's rolled up real tight so that you can throw it, and then they pull this cord and it actually blows up to a flotation device. So there's a lot of those types of things. Even a rope to pull them in would work. So some things to think about that you could throw your victim. Okay, what happens if you get to a person and they are unconscious? Okay, so first, as long as it's safe for you to be in the water. And the pictures I put up here, neither one of these guys are technically being safe. Maybe they're trained lifeguards, I don't know, but they're not wearing flotation devices, which isn't safe. But if you were able to get to a person and they were unconscious, the first thing you want to do is get their face out of the water. So in both of these pictures, these people are holding their faces up out of the water so that their airway is open and maintained. Okay. Now, what they probably have done real quick is checked for breathing. Okay. So this guy's just holding her face up out of the water, and she seems to be unconscious, but he's not doing anything. So possibly she's still breathing on her own. I don't know. This guy looks like he's giving her breaths. So maybe he's holding her above water, and then he realized she's not breathing. Well, you can't actually do full CPR in the water, right? Once you start pushing on their chest, you're just going to push them under the water. So the only thing you can do is you can give those breaths. And so they don't really teach it as a separate skill, but if you can't do the compressions because you're in the water, you can at least do breaths. And remember, you breathe in for 1 second, count to three, breathe in again, count to three. And you could breathe in enough times that she may cough up some water and start to breathe, which is fantastic. Okay. So that's really all you can do until you can get people out of the water. And then once you are on a surface that you can begin CPR, you need to start it immediately if they're not breathing. If you find someone face down, particularly like so this girl here, particularly if you think maybe it was an accident where they have injured themselves, a head, neck, or spine injury, this is the head splint technique. Okay. So what they're doing is he took her arms and he pushed her arms up above her head and he's kind of squeezing them together. He's using her own arms kind of as a splint, and then he's just going to use her arms, flip her over, and now he's going to hold her this way. Okay. So this is called the head splint technique, where you basically splint the person's neck and head with their own arms and then use their arms to spin them in the water and then hold them face up. Again, and that helps minimize spine movement. Okay. Now, if you can get them out of the water safely, a beach would probably be an easier situation because it just gets shallower and shallower. A pool might be different, particularly if this is a spinal injury, because then there's a big, step you have to get up, right? So you have to be able to try to get them out safely if you think they have an injured spine or neck. Okay. A lot of times, what they'll have you do is just hold the person in place until help can get you, somebody can help you get them out of the water safely. So if you can't get them out of the water and they're not breathing, they do say just to do the breaths. Okay, do the breathe in, count to three, breathe in, count to three. Keep doing that to see if you can get her to cough up that water, right? And then as soon as people can help you get her out of the water safely, you guys want to do that. And if she's still not breathing, start CPR. In a normal situation, you want to get them out of the water right away. This situation is different because we're not sure if there's an injury. Okay, so this is why we're being a little more careful if someone has particularly pools. Pools tend to be a higher likelihood chance that they have hit their head or their neck because it's a cement bottom. Now that doesn't mean that can't happen in other situations. For example, piers and things, there are sometimes boat launches or metal contraptions underneath the water, right? So just some things to keep in mind. Moving an unresponsive person to dry land. We've already talked about the moves and you guys already know these. So you can use some of those rescue moves to get them onto dry land, especially if they're unresponsive. The safest and best one is going to be the blanket drag if you have a blanket or a towel. You could also do the beach or basically the armpit drag. You could do the two-person seat carry, possibly, and possibly the pack strap carry. Now, the pack strap carry is actually probably best started in the water, because if somebody were to be completely unconscious and you're trying to pick them up off the ground and put them on like a backpack, that's too hard. But if you are in the water with them, that would be much easier to get them on your back like a backpack and then carry them out of the water that way. So that's where the pack strap carry is going to come into a little bit more helpful in a drowning situation. What if the person is responsive? Basically, use the walking assist, get them up to dry land. Do check all care, check for injuries, particularly neck spine injuries. It doesn't matter if they seem fine. If they actually inhaled water and they were coughing up water, they should seek medical attention. People have developed complications up to 72 hours later after an incident that ended up being fatal. So when you've inhaled water, you definitely need to get checked out. okay, regardless if you now are conscious and seeming fine. So keep that in mind as well. All right. So in general, the drowning victims, it's basically just do your best to get their head above water, give them breaths, get them out of the water, call 911. If they're not breathing, start CPR. Okay. Um, what about someone who's fallen through the ice? First and foremost, do not walk onto the ice. That is how you also become the next victim to go through the ice. All right. So call 911 immediately. They want you to try to use reaching and throwing assist the best you can. Anything you can throw to them. Um, is going to be helpful. Now, one of the things that you might be able to tell them to do if they're not panicking too much. Now, they don't have a lot of time before they go hypothermic. Okay, um, you want them to reach their arms out onto the ice as far as they can, and move their body into a horizontal position. So almost have this guy put his arms up here and put his legs up, almost like he's laying. And sometimes what they can actually end up doing is rolling themselves, not pulling themselves, but rolling themselves up onto the solid ice. So if they can try that where they float kind of horizontally and then roll, that has worked before. Okay. The other thing is if they cannot get out and they're starting to show signs that they might go under, lose consciousness, they're not really with it anymore. One of the things you can try to have them do if you can't reach them is have them put their arms onto the ice and stop moving them. And what is hopefully going to happen is their arms will freeze because they're wet onto the ice, onto the solid ice. That way, if this guy does lose consciousness, he's at least kind of frozen and stuck to the ice so that when help gets there, they can get him. Because if he goes under, the chances of their survival are very low. Okay. Just try to keep the person talking, reassure them until they're safe. And then once they're up and out of the water, you need to help take steps to minimize hypothermia immediately. Now, hopefully, help is there, right? But if not, you need to get them into a warm building, get these wet clothes completely off of them, surround them with blankets. Remember, you don't want to warm them up too quickly. So do not put them in a hot tub. Do not put them in a hot shower. Don't put them too close to a fireplace because remember, that can cause irregular heart rhythms. So you want to make sure that you warm them up naturally, meaning get in a house out of wet clothes, wrapped up with blankets. Obviously, they should still be seeking medical attention. So 911 should have been called at this point. Okay. I included some links and videos that you can watch. This one is things you can do to try to uh, help someone who's fallen to the ice. The last thing I want to talk about when it comes to winter water activities is just because others are doing it does not make it safe. So these are some pictures I found, and this one in particular is from Lake Geneva, which is close to us. I think it was, I don't remember, 2 years ago now, maybe 3 years ago. A bunch of cars were parking on the ice, and every car saw the other car do it, so people kept doing it, and then all these cars went through the ice. Now, luckily in this situation, it was very shallow, and nobody was injured or hurt. But it could end up being people could be trapped. You know what I mean? That can be really dangerous. So make sure that you do your own research. You should know when is it safe to go out on ice. What does the temperature of the water have to be? How thick does the ice have to be? What's the temperature of the air have to be? Do your own research. Okay, snowmobilers go through the ice all the time. Ice fishermen don't go through as much because they're obviously not as heavy, but as a snowmobile, but it can happen. So the whole point of this chapter is being safe and being prepared, doing your research first, right? Um, so that you're safe. Okay. So in general, you want to prevent water-related emergencies before they even happen. Learn how to swim. Make sure all family members know how to swim. Be prepared and have appropriate swim gear and safety devices if you're going to be on a boat. Do not go on a boat that doesn't have any life jackets. Okay. Make sure flotation devices and life jackets are U.S. Coast Guard approved. I mean, there are some cheaper ones out there or old, really, bad ones that might not be up to par anymore. But it's important, right? That your life jacket actually still works and floats. Never leave children alone around water. Does not matter how deep it is. Okay. Don't swim alone. Um, Obey all posted rules, including no diving signs. A lot of people wonder why there's a no diving sign. Well, maybe there's a reason that there is. Okay. Swim in areas that are supervised, particularly with lifeguards who are trained. Okay. Take breaks when you're tired. Stay hydrated with water. Avoid alcohol and or drugs when you're out on the water. And that's alcohol's a hard one. People like to boat and have beer, right, or drinks. It's just it's kind of a summer activity, but be smart about it. You know, make sure that people are, because they're also out in the sun, right? Make sure they're taking in water as well. Make sure they're not getting too intoxicated. Make sure they're not diving into the water without life jackets on, right? Be knowledgeable about the dangers in your area. Sometimes there are currents or even dangerous animals that can be in the water. Now, around here, you're not going to get eaten by an alligator, but if you live down in Louisiana, that might be a different story. Okay. If you are going to Lake Michigan, there are definitely currents, rip currents that occur there. People have drowned on Lake Michigan out, going to Chicago with things. So be careful of these things and just be educated about proper procedures in the water, particularly related to sports, like water sports and things like that, and know the risks. For example, if you wanted to rent a boat this summer and take it out of the lake, what do you need to do in order to be able to do that? And the answer is have a license. You may not have any idea how to turn on a boat, how to drive a boat, how to do anything on this boat, but they'll give you the boat as long as you pay for it and you have a license. So that's what I'm saying is there are sometimes people on the water who really don't know what they're doing. I've seen people who didn't realize that once it gets dark, there has to be certain lights on your boat. And if those lights are not on, no one can see your boat, right? So making sure that there is someone who knows the proper procedures for boating, for jet skiing, whatever it is that you're doing out on the lake or on the water, um, who know the risks and who know what to do properly. All right, so that is the end of chapter 20. It's a pretty just kind of like, I would say, um, using your common sense chapter. Okay. All right, next I want to quickly talk about chapter 21. Okay. I actually have them both on one PowerPoint, but I'm going to stop at the end of chapter 21. All right, so chapter 21 is on special situations, including your pediatric victims, your children, your older adults, and other types of special victims or situations. Okay. First, in general, you may have an emergency where the person has special needs or special considerations. Because maybe it's a child, maybe it's a child who doesn't have an adult around, and you're stranger danger, and they're screaming. They won't. They don't want your help. Maybe it's an older adult who's confused. Maybe it's a person with a disability who cannot communicate with you somehow. Maybe it's a person who doesn't speak the same language as you, and you have no idea what they're saying. So just think about there are lots of situations where people may still need your help, but it's not going to be a normal conversation, or as you would with somebody who is an adult with who speaks the same language as you and things like that. So first, let's talk about children and infants. Again, they really don't like strangers. They may be very apprehensive. They have been taught stranger danger. So, one of the first things a lot of them will do is not communicate with you, not do what you want them to do. Okay. They also have a hard time telling you what's wrong, particularly the younger they are, right? So they can't express why they're screaming. They can't express what is hurting, right? So sometimes you just might have to observe the child, look at them, see if the child is like clutching an area of their body, see if they're breathing or if they're bleeding anywhere, even without touching them. Okay, are they conscious? Are they breathing? Does he have a bump on his head? Why is this child screaming hysterically? Where is the blood coming from? You might just have to kind of observe them first. Ways to communicate with them. Just do the best you can to reduce their anxiety and panic. You want to try to gain their trust and cooperation. But most importantly is if there is a guardian, you need to get consent. Now, usually if there's a guardian around, the child may not be as panicky, which they could be, but you get consent from the guardian and then you can address the child. Okay. Now, a lot of times if that guardian is holding the child, the child might be a little bit more calm. So that's something that they can do too, is hold the child, right? But be less intimidating to the child in any way. Get down a little bit, if you're a big and tall, intimidating person to them, kind of get down, like, squat down a little bit, get down at their level. Talk to them and observe them first before touching them. Use a calm voice, smile, use their name. Talk slow, use words they understand. Just tell them what you're doing, reassure them they're going to be okay. You can start at the toes and then work your way up so they know you're not going to hurt them. You can have the child point to where it hurts too. Sometimes that will help. And also making sure that the family isn't panicking as well. Because when the family is starting to freak out, then the child's going to freak out. So just do the best you can to keep them calm while you're trying to assess them. In the end, if this is a really severe situation and it's out of control, you're going to call 911. Okay. So this is more like maybe we don't need to call 911. This person just needs some help. But in the end, if you can't help this person, this child, and it's out of control, just call 911. Right. Kids do get sick a lot though. So there's a lot of common childhood illnesses that you should just be aware, particularly if you do have kids at home, you are going to have kids at home, if you're going to be in charge of children, it's kind of important for you to know which ones are serious. Like, when is this a big deal, right? Because they get sick a lot. So it's important to know how to treat the common ailments that children have, when to go to the doctor, and when to call 911. Okay. So some of the common ailments for children are: I have a stomach ache, I have a sore throat, I have a cough and runny nose, diarrhea, vomiting, ear infections, and fever. These are very, very common in children. When are those serious enough that I need to call 911? When abdominal pain is accompanied by excessive vomiting and diarrhea. Children are small, they can become dehydrated pretty quickly. So if you have a child who is vomiting a lot and has a lot of diarrhea and they're not able to keep down water, they're going to become dehydrated quickly. Okay. Severe abdominal pain that just becomes worse with time, they're not getting better. If you see any blood in their vomit, their stool, their urine, if their belly starts to look bloated or swollen, if you start to see changes in consciousness, like drowsiness, I think I spelled that wrong, drowsiness or confusion, okay, any signals that look like shock, or if you suspect any other life-threatening condition at all, or if they have their first febrile seizure. Remember, that's a seizure that's typically associated with a really high body temperature. These are ones where you're just going to call 911. Another thing to keep in mind is that, generally speaking, we do give children medicine to bring their fevers down, but we use Tylenol. Okay. So if a child has a fever and you're trying to bring their fever down, do not give them aspirin. Okay. Do not give children aspirin for any fever or other flu-like illness. It can cause a serious condition called Ray's syndrome or Rye syndrome, and that can affect the brain and other internal organs. Okay. So just make sure when you have a sick child that you are giving them Tylenol, which is generally acetaminophen, or ibuprofen. Okay, those are the ones that you're going to give them. I think most children's medicine is Tylenol based or acetaminophen based. Another thing that happens with children a lot are injuries. Injuries are the number one cause of death in children because, children don't die of heart attacks and strokes and things like that. So injuries are the number one cause of death in children over 6 months of age, and most of them are due to car accidents, particularly children who are not strapped in properly, or car seats that are not installed properly. So always follow motor vehicle safety laws regarding children. Remember that, when a child loses blood, a little bit of blood for them, or a little bit, the same amount of blood for us is a large amount for them. And then they do have big heads. And so they have these big bobbleheads that often are injured in accidents. So I just had some pictures of parents being unsafe. And, the funny thing is, back in the 80s growing up, I remember my dad letting me do this. People, I think people are a little bit more aware these days, but it still happens. Another thing to keep in mind when it comes to children is poisonings is another one of the top causes of deaths for children and infants. Okay. We already know babies, little kids like to put things in their mouth, and a lot of these medicines to them look like candy. So they're going to eat them. So just be very cautious about the household products you have that could cause poisoning, or medications that can cause poisonings, particularly because those medications may look like candy. But we've already talked about, what to do for poisoning situations. So the next thing is SIDS. SIDS is the sudden unexplained death of a normal healthy baby. It's the third leading cause of death for infants between 1 month and 1 year, and it usually occurs while they're sleeping. The care is the same for cardiac arrest. You go to the baby, you realize they're not breathing, you call 911 and immediately start CPR. Okay. We don't really know exactly what causes SIDS, but we do know that by creating safe sleep spaces, that we have reduced the number of SIDS in half. We've cut that rate down to 50% by literally following safe sleep situations, which means the baby is in their own crib with nothing but a sheet, no pillows, no blankets, no stuffed animals, on their back. So they're on their back in a flat crib surface with nothing but a sheet. Okay. And the way that you keep them warm is what you dress them in. So there are no blankets for babies. You don't want any crib bumpers. Bumpers are the things you put around the crib because people think, oh, they're going to bump their little heads. But they can actually roll into those bumpers and then they cannot roll out of them and they suffocate. Okay. So the safest way for your infants to be placed from up to a year old is flat on their back in their own sleep space, like a crib or a bassinet, um, with nothing in there. The only thing that should be in there is the mattress and a sheet on it. That's it. If it's cold out, they have like little sleep sacks and swaddles and things you can put on your baby. But that's how you warm them up. You do not warm them up with blankets and things. There's actually a pretty good website you can go to about safe sleep for babies if you're interested. So another thing to keep an eye on when it comes to kids is child abuse. That happens. So signals of child abuse can be injuries that don't fit the description. So they have a burn mark on their arm and you say, well, what happened? And they say, oh, I fell down. You're like, well, that's a burn. That's funny, right? Fractures in children younger than 2, particularly unexplained fractures, bruises and burns in unusual shapes, or injuries that are in various stages of healing, unexplained cuts, lacerations, burns, injuries to the genitalia, pain when the child sits down. That can be a sign of sexual abuse, and just more injuries than typical for a child of that age. This is a hard situation because there are some children who are just crazy, right? Have you ever seen one of those kids that they're always getting hurt? They jump off everything. They have no fear. This kid is bruised from, forehead to toe every day because this kid just is a nut, and there are those types of kids. But if you think, or if you suspect that the child is being abused, you may be the only person who reports it. So just think about that. If you're the only voice for that child and you suspect it, you should just report it. Okay. They need you to do that. And then there's this is another type of child abuse, but it's child neglect. And this should also be taken just as seriously and reported. So lack of adult supervision. The children are malnourished, very poor hygiene, living in unsafe environments, chronic illnesses that are left untreated, or wounds that are not cleaned and taken care of, and they're not dressed appropriately. A lot of times they have no food, they're always hungry. So if you think a child's being neglected, you should also report it. Okay. How do I report child abuse and child neglect? There are 1-800 abuse hotlines. You could call 911. You could look it up on the internet. There's probably almost every town has a local reporting agency. You could probably even call your local fire department. But making sure that it gets reported is important. Okay. Right off the bat, though, if that child's actually like injured, you do want to care for that injury. So if you're treating them like, oh, hey, you have a cut on your arm, let me clean it and stop the bleeding for you, go ahead and do that. If 911 is called, you can, when they get there, when EMS and police arrive, tell them, I think this child's being abused. Okay. Report suspicions to your community or state agencies, and Another thing just to keep in mind is it's not always children that are abused. Oftentimes, elderly people are being abused, or people who have different types of disabilities who can't communicate as well can be abused. So you can report abuse on anyone, but children really need you to do that for them. So I included some links if you're interested, but if you went to your Google and just Googled how do I report child abuse in Rockford, Illinois, you would find a way. Okay. Now, if you are a mandated reporter, that means you are legally required to report abuse. Okay, a mandated reporter is somebody who has done training and who has signed a document saying, I will report abuse. Okay, you do not have to be a mandated reporter to report abuse. Anybody can report abuse. But every law has a little bit different, or every state has a little bit different laws requiring mandated reporter things. But in general, people who are in these types of jobs, they are going to be required to be mandated reporters. So when I was a middle school teacher, I had to become a mandated reporter. That means we had to go to a little training workshop. We watched videos, took a little test, and then we signed this document saying, if I suspect a child's being abused, I will report it. Okay. So people like doctors, teachers, social workers, police, EMS, firefighters, things like that, they are going to be mandated reporters, which means they are required by law to report abuse. Um, and they should do so. Okay. Now, let's say I was a middle school teacher and I thought this sixth grader was being abused at home, and I didn't report it, even though I'm a mandated reporter. They probably couldn't prove I knew that, right? Unless the child actually told me, right? If I just suspected it and kept it in my own head and never told anyone, they're not going to be able to say, well, hey, you thought this. They're not going to know I thought it. But the point is, when you go into these roles, this is a role in where these children need you to report abuse. Okay. But again, anybody can report abuse. All right, so let's talk about the older population then. Generally, we're talking about people over 65 years old. This is hard. There are some people I know who are 65, 7 years old who are still, lifting, playing, running with their dogs in the park, playing racquetball. And then there are people who are 50 who are incredibly unable to move. So it really just depends on the health of the person. But just know in general, obviously, the older the person comes, and it's normal for these things to happen, their lungs become less efficient. So they don't breathe as well. They don't pump as much blood through their heart. So they can pass out easier, right? They get less oxygen flowing through their body. Their heart rate slows down. Their blood vessels start to harden. Okay, all of these are put them in increased risk for heart attacks and strokes. Their hearing and their vision declines, right? And their reflexes slow down. This puts them in danger of being injured easier. And 4 out of 5 of them will develop some kind of chronic condition. We're talking about things like diabetes, high blood pressure, high cholesterol. So as we age, there are a lot of things kind of working against us that could lead us to needing help, right? So they're considered a special population. Now, when you're checking or helping an injured or ill adult, I think the biggest thing to remember is that oftentimes they're very insecure and embarrassed that they cannot take care of themselves. If you think about it, losing your independence is pretty rough. So do the best you can to be understanding. And when I used to be in high school, a transporter in the hospital. That meant I would go get patients from one floor and bring them down to their MRI or bring them to their colonoscopy. So I transported. And a lot of the older people were mean. They were mean, mean, and crabby. And at first I was like, God, why are these people so mean to me? I'm just taking them to their appointment. But then as I got to know some of them, I realized, they're in pain. They've lost a lot of loved ones over their lifespan. They're embarrassed and they're angry that they can't walk on their own, right? And so I started to realize that they're not really mad at me. They're just, they're in this space where they don't want to be. So just try to keep that in mind. If they are not very nice to you, I used to just kind of play dumb blonde and be like, oh, just pretend like I didn't even notice they were being mean. That helped, I think. But so use their name, be respectful. Position yourself at eye level, check for check for aids that will help them, make them feel better, such as, oh, do you need your glasses? Here's your cane. If someone is like looking for their teeth, get them their teeth. That's embarrassing, right? hearing aids. Give them these things and don't take them away from them, because these are the things that make them feel more normal, right? Speak slow and clear, but not demeaning, right? Ask if they have any medical conditions, just so you know about it, right? Ask if they have any medicines that they take. Um, and recognize that sometimes they will deny that they need help because they're super afraid of losing their independence and getting put in a home. So a lot of times those people will say, no, there's nothing wrong with me. I don't need your help. And the reality is they still may, but they're so afraid that if they say, yes, I need help, that they're going to be put into a home. So keep that in mind too. If they refuse, flat out refuse your help, you obviously don't have consent and you can't touch them, but you could still notify, whoever needs to be notified, okay, to get them help. And if 911's that who you need to notify, then call 911. A couple other things to remember for older individuals as well. Sometimes it's not that they're just lying to you because they're embarrassed. They could also have Alzheimer's, dementia, things like that, where they're confused. So remember that it's very likely they may have altered thinking patterns, confusion, um, may forget where they are. Um, this also, all of this stuff puts them at increased risk for falls. They're at increased risk for breaking their bones. They're at increased risk for head injuries, and they are more susceptible to extreme temperatures, so extreme hots and colds. So those are some other things to keep in mind when it comes to older adults as well, which means we have to look out for them. All right, so then we have another population of people with a disability. Okay, so the disability is just the absence or loss of some kind of function. Okay, an impairment is a damage or reduction in quality of some kind of function. Okay, so when you're approaching someone with a disability, don't assume. Just talk to them like a normal person. At first, speak to them before touching them. Listen to what they're saying. Look for body language. Ask how you can help them. Explain who you are and what you're trying to do. See if there are any other guardians around. Ask them for assistance or information on how to help them. Like, well, how can I help you? Okay. Do not take any assistive devices away from them. See if they have a medical ID tag that you might be able to see. Be aware of animal assistance. Do not try to touch them or take them away. If you can, try to use body language and verbal cues to communicate. Okay. Use common sense. That's the best thing you can do. And I use this one all the time. Someone with cerebral palsy versus someone with autism. Okay, so you go up to someone with cerebral palsy. What do they look like? Well, they could possibly be in a wheelchair. They may have very little control over their body. They may not be able to talk, to control their hands and their feet and things like that. But their brain may be perfectly fine. So, for example, if you walk up to someone with cerebral palsy who's in a wheelchair and who does not have control of their body, and you talk down to them like, they're an idiot, they're going to be like, what the heck, man? I just have cerebral palsy. I'm not dumb. Whereas maybe you go up to somebody who has autism and they look just like you. They're not in a wheelchair. They can move normally. And then you go to talk to them and they don't communicate back to you. Okay. Or they do maybe an odd behavior that kind of takes you by surprise. So you just have to use your common sense. Okay. See if bystanders can help in any way or possibly translate for you. See if there's any kind of assistive devices that might be able to help. For example, I do know that some people with autism will wear these, they're called PEC cards, and they have pictures on them. So you could point to the pictures, and maybe the person with autism then will hold up a sign, or hold up the picture that says, I don't know, lost or bathroom, and then you could maybe try to communicate with them that way. If you cannot find a guardian and you cannot figure out how to communicate with them and they need help, call 911. I mean, that's the best thing you can do. All right. If there's nobody else there helping and you don't know how else to get them help. Also, if they become hostile at any point, you need to back away, withdraw from the situation, call 911 and let the authorities take over. You can only do the best you can do. Okay. But I think the worst thing for any of these people would just be to walk away and be like, well, screw you then. you know, the best thing to do would just be to get at least somebody on the way who can give them the help they need. There's a real quick blurb in your book about crime scenes and hostile situations. Obviously, there is no, I don't think there's necessarily right or wrong when it comes to these situations. A lot of these are best, chances of survival type of things, and, statistics on, the best way to survive and deal with things. But obviously, if you think you're walking into a crime scene, or you're in a situation that's really hostile, use extreme caution. Try to call 911. Try to stay at a safe distance. Try to keep yourself locked away from the danger if you can. If you think somebody has committed suicide, they don't want you to enter the scene unless you think there's a possibility that you could actually provide some kind of first aid that might save their life. But if you know that it's too late, then they don't want you going in to the scene of a suicide. If it's a crime scene and there's nobody that you're going to be helping, they also don't want you walking into a crime scene. Um, if the scene is safe and you do have someone who's suicidal, you can try to keep them talking as long as it's safe for you, meaning they're not threatening to shoot you or something. But if you can keep them talking till help arrives, things like that. So if you are part of a crime scene, don't be walking around the crime scene. Stay right on the exterior, but don't leave. They're going to want to interview you. Things like that. Um, this is a one where I get a lot of controversy. They do not want you to approach a physical or sexual assault to intervene. Now, there's a lot of people in class who've been like, whoa, 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 whoa. So you're just saying if I see someone getting beat up or someone being assaulted, I'm just supposed to let it happen. And the reason they're saying that is they don't want you to then become a victim too, right? But you could at least call 911. You could make a huge ruckus. You could probably do something. Now, there's always going to be someone who's going to be the hero, who is going to jump in, who is going to save the day. Is that you? I don't know. You may end up jumping in, saving the day. You're a hero, great, and everything's fine. But you could also be the one who jumped in and didn't realize the guy had a gun, and then he shoots you dead. So that's what they're trying to get out here is those are, people who really are at the uh, they're willing to stop at nothing. So you're at extreme danger if you put yourself in those types of situations. And if at any point somebody refuses care and or threatens you, withdraw and call 911. I just put this in here because there's like there's a Discovery Channel on YouTube has a series of little like how to survive situation videos, and one of them is a kidnapping, one of them's falling through the ice, one of them is, I don't know, being bitten by a shark. And so there's a ton of little they're like 5-minute clips. They're kind of interesting. But this has come up in class a lot. What if someone puts you in a trunk? Obviously, the best thing if somebody is trying to kidnap you is they actually say, statistically speaking, even if they have a gun, do not do what they want you to do. The best way to get away from these situations is to be a terrible victim. Be the victim that they know they're going to regret taking, right off the bat. Oh, this person's not going to listen. They're going to scream. They're going to fight. They want someone who's going to be quiet and do what they say. So if you're quiet and do what they say, they're going to make perfect. I got the right person. So don't get in the trunk, run, scream, kick, bite, whatever you have to do. Leave things behind, leave DNA, hair, blood, nails, spit, whatever you can do. If you are put into a trunk, you can try to rip cords, anything that's going to, bring the taillights out. You can kick your hands and feet through the lights and stick them out. People have been found in trunks that way, right? So just be a bad victim. Now, is that a fail safe? No, they could just end up shooting you, but statistically, they're going to be like, crap, I picked the wrong person, and they're going to run. So don't let them get you into a car. Then your situation is even worse. Okay, so that is the end of chapter 21. I'm going to stop the video there because I will pick up next time, and I will finish up with chapters 22 and 23. So that's it, guys. And I will talk to you soon. Bye.